Welcome to Monday's edition of COVID-19. Fewer testings this past weekend have lowered Korea's daily tally amid concerns of a fourth wave as cases unfold within the academic arena. We have details later on after a look at the situation over in the UK. Let's start now with the broader pandemic coverage. Now, so what is the latest here in Korea for this Monday?
Sunny, almost 140 fewer cases were reported this Monday, and bringing the number of total cases this Monday to the 500s now. And that's 512 domestic transmissions and 20 cases from abroad. So with that, Korea has a total of 114,646 infections and over 1,800 COVID-19 related deaths. Now, the average number of domestic transmissions in the past week remains in the 600s. Now, before Monday's drop, for 5 straight days, we had numbers in the 600s to 700s. And if we compare Monday's caseload for roughly a month, we do see a rising trend here, but a on-week drop by 55 infections. Now, by region, the proportion of infections in the capital region here stood at 56% this Monday. So that is quite a drop, which means accordingly, there has been a rise outside the metropolitan region, standing at 44%. Now, on the Sunday, meanwhile, the government confirmed the first case of the Indian variant, also known as the double mutant, here on Korean soil. Authorities are closely monitoring these cases. 9 out of 94 COVID-19 cases from arrivals directly from India were confirmed with these strains since January.
Right. So meanwhile, on an optimistic note, vaccinations for additional target groups have kicked off on this Monday.
Right, Sunny. That's the vaccination for care workers, for seniors, the disabled, as well as veterans and flight attendants. So this group will be administered with the AstraZeneca vaccine beginning this Monday at almost 1,800 hospitals that have been designated as COVID-19 vaccination centers. Those under the age of 30 are being excluded, though, due to concerns over rare blood clots. Also, beginning this Monday, vaccine registration for doctors, nurses, pharmacists, and hemodialysis patients has started, with inoculation to begin next Monday. And so far, 2.92%, so a little less than 3% of the nation's population has received vaccination, with more than 1.5 million having received at least the first shot of vaccination. Now, still a long way to go, while discussions over in the U.S. regarding the need for booster shots, meaning extra shots of Pfizer or Moderna doses, is raising concerns here in Korea as well as in other countries due to supplies of vaccination, with top U.S. disease expert Anthony Fauci saying on Sunday that a public health decision will need to be made on this issue. Now, let's also get a glimpse on the figures abroad. We have the U.S. at 32.4 million infections, and India has hit the 15 million mark in total cases. We also see that Indonesia has surpassed the Czech Republic in total amount of cases at 1.6 million. And in total, the world has 141.9 million cases, with almost 700,000 new infections reported in the past 24 hours. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, so thank you for now. Right, it's been a week since Britain's partial reopening, and non-essential businesses like gyms, hairdressers, restaurant patios and beer gardens are hosting patrons for the first time since January. For more on the situation there, I have Joanne Harris live on the line. Hello, Joanne.
Good afternoon.
Right, Joanne, let's begin with the general atmosphere in Britain amid the partial ease in lockdown.
It's pretty good here, actually. I think we are lucky that we've had some good weather this week. It was cold on Monday, but despite that, everybody got out and went to the pub, started going to restaurants. Shops are quite busy, and I think people are quite happy to finally be experiencing some more freedom. It's been a very long winter. The weather's been bad, it's been cold. We've all been stuck inside, so it's really nice now to be able to get outside and meet friends. The only problem is that you have to plan everything, because you have to book if you want to go to a pub or a restaurant. You can't just turn up and say, hey, I'd like a drink. And that makes life a little bit trickier. But generally, people are happy to do that. in order to be able to see friends and have something that is more like a normal life. And I think it feels like there is a light now at the end of the tunnel after a very, very long year indeed.
Right, Joanne, that is good to know. Just for the sake of clarity, Joanne, so outdoor dining and drinking is allowed, but indoor is not yet allowed.
That's correct, yes.
I see.
Indoor hospitality will open in about a month.
Okay. Now,
Hopefully.
while there has been a dramatic drop, Joanne, in daily tallies, I understand the risks remain given the presence of variants in the country. Could you tell us a bit more about that?
Yes, we've been seeing a surge in the South African variant, in particular in parts of London. And where that is happening, the government has introduced surge testing. So there are extra testing sites being set up. You can either book an appointment at a pharmacy or at one of the testing sites, or even go and pick up a test to do at home and then send it back. So they're encouraging everybody who lives within one of the surge areas to get tested. And the message is quite clear. It's all over social media. I'm in one of the areas and my local council sent an email saying, please go and get tested. And it's really easy to book. You just book online as a central website to book. So it's very easy, actually. And I think people are realizing that there is an importance to get tested and that it's actually easy and it's free and it doesn't take up too much time. So people are willing to play their part and see if we can control the surges and keep the numbers going down, because there has been a dramatic decrease over the last few weeks, to the point that we're now at a very low level.
Right. Joanne, meanwhile, university leaders, I believe, have been calling for a reopening of campuses, upset about being excluded from the recent partial reopening. Could you elaborate on this, please?
Yes, at the moment, universities are not allowed to do face-to-face teaching until the 17th of May at the earliest under the current roadmap. And that really is too late to do any face-to-face teaching before the end of this summer term. It's almost pointless. They'll have 3 or 4 weeks of face-to-face teaching, and therefore most universities under the current plans are not actually planning on doing any lecturing or classes before September in the new university year. And I think they feel that students have lost out on a lot of action this year and a lot of teaching time. And students are angry because they've been paying tuition fees for the entire year and only receiving online teaching. So at the moment, there doesn't seem to be much likelihood of anything changing for universities, and it doesn't seem like we're going to see much actual teaching in person before September or October.
I see. Joanne, what can you tell us about the UK's public inoculation drive thus far?
It's gone really well. I think it has changed the perception of how the government has handled the crisis. So until autumn last year, there was a lot of criticism of the government for being too slow, making decisions too quickly or too slowly. It was never right. But the vaccination process has been handled by the NHS. It's been handled very well. We are racing ahead of most other countries in the world, which is extraordinary. Now over 60% of adults have been vaccinated, about 50% of all the UK population, which is amazing. They're currently doing over 45s. So they're rolling it out into progressively younger age groups as we go on. So it seems likely that within a month or a couple of months, we'll have the vast majority of the country will be vaccinated, which is fantastic.
Right. Also, Joanne, keeping in mind the publicity that the Oxford AstraZeneca vaccine has been receiving in recent days, what is the public response to this particular vaccine over in the UK?
I think people are still happy to have it. I don't think vaccine education is particularly good here. We do have a strong anti-vax stream in the public, and there's still quite a lot of people on social media who are saying don't get the vaccination, blood clots. But the government are going to offer a different vaccine to under 30s who are perceived as having the highest risk of blood clots under AstraZeneca. And I think most other people would be perfectly happy to have it if it was offered to them. The AstraZeneca vaccine has a good public opinion because it's a British vaccine, so everybody likes it because it's British, and so it's got that on its side, despite the risks involved. But I think if the government do give a different vaccine to younger people, that problem is solved. That reputation problem is solved.
I see. And Joanne, what is the latest with regard to efforts for a vaccine passport in the UK?
It's a bit unclear. We've had lots of different messaging. before we started opening up, there was talk that you would have to have a vaccine passport to go to the pub or go into a shop. And then Boris Johnson said, no, that's not going to happen. Absolutely not. At the moment, Britain is going to be part of the international effort to roll out some sort of vaccine passport for international travel. And I think that's where it's most likely to be applied. But it's not very clear about how it would be used and what the requirements would be for a vaccine passport. There's quite a lot of people who are not very keen on them because they see it as infringing your privacy. Until we have more clarity, it's going to be difficult to convince some people that it's worthwhile. And other people, I think, are just reserving judgment because we don't really know much about it at this point.
Right.
So,
one final question, Joanne. What are the prospects for international travel then?
So international travel is looking a little bit more hopeful. Originally, we were told we were not going to be able to travel until June at the earliest. There's now talk that we might be able to travel in May. There's going to be a traffic light system where countries put on 3 different levels of traffic light, green, amber and red, depending on the virus in their countries. And then there are different rules for test pre-travel and quarantine when you return for those different countries. So that is the current plan, and it may be allowed from the 17th of May, but the government has said they will confirm in early May if that's going to happen. So at the moment, it's still difficult to book. I mean, booking an international holiday is probably not the best idea because it could well be cancelled still.
Right. All right, Joanne, as always, thank you very much for your time and your thoughts.
Thank you.
Right then, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Monday.
Today we have 512 new local infections and 20 new imported cases. The total caseload now stands at 114,646. Currently, we have 8,371 people under quarantine undergoing treatment, and there are 99 patients with critical or severe conditions. We had 4 additional fatalities, with the death toll now standing at 1,801. The fatality rate stands at 1.57%. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the recent major local clusters, please refer to the press kits. And during the past week, here are some details and the risk factors. And during the past week, on a daily average, we had 621 cases, and this is about 7.2% rise from the previous week. And you can see the graph. We have seen a 3-week consecutive rise. And the imported cases, we have seen a daily tally about 21, which is a slight increase from the previous week as well. And nationwide, we see about 600 daily cases. And by region, we see in the metropolitan area and Honam and Gyeongnam province, which is seeing a major increase. And also, we are seeing a nationwide spread of the virus here in South Korea. And during the past week, looking at the sources of infection, we have seen a family or colleagues or acquaintances at these kinds of contacts with previously confirmed cases stands at about 47%, meaning that people have been infected with COVID-19 through their family members or colleagues. And as for the cluster infections, we have about 19% being reported at hospitals and nursing homes. We have seen 1.3%, which is only about 59 cases, and this has been a steady decrease. And we have about 28.8% of cases that are under investigation right now with unidentified sources of infection, and this has surpassed the 25% threshold lately. And as for new cluster infections, we have 20 new clusters, and major of them were workplaces and nursing hospitals or hospitals, and also there were family and acquaintances meetings and churches as well as schools. And the number of critically ill patients is decreasing on week, and also we have seen a decline and remaining hovering around 100 since mid-February. And our fatality rate has also been dropping steadily, and now it stands at 1.57%. And all of the fatalities last week, we have seen most of them were above the age of 60, with majority of them aged over 80. And out of these infections, we have seen the foreigners proportion, which has been an increase after Lunar New Year holiday. However, we have carried out major crackdowns and investigations, and this is only about 38.8%. We have seen an on-week increase. However, it's on a steady decline. And next, we would like to update you on the new variant cases here in South Korea. Currently, the health authorities here in South Korea, we are monitoring the new variants, and we are also expanding our scope of monitoring. And after the February, we have been carrying out more swift DNA and genetic testings, and we have been looking at the spike DNA testings, and we have been looking at these analyses right now. And among the infected cases, we have seen starting compared to January and March, we have seen a 5-fold increase, which is about 17.9% of the total infections undergoing the analysis for such new variants. And as for the imported cases, we are looking at about 50% infections, and also about 16% of the total infections here in South Korea, which have been local transmissions. And we have seen 762 samples that have been tested, and we have seen 35 new variants, which is about 5% among the local cases, and also 52% of the imported cases have been reported, and we additionally found 70 more new variant cases from last week. And right now we are looking at the types. The UK variants, they account for about 383, and South African variants stand at 51, and 10 Brazilian variants have been identified here in South Korea. And last week, we also have been looking at the cases, and we also see 35 of imported cases and 35 were local transmissions of these new variants, and we are seeing an increase in the proportion. And we have seen 9 cluster infections here in South Korea. We have identified the new UK variant, especially centering around Gyeongnam province and Ulsan city, and we are seeing a local transmissions of these new variants. And until now, we have seen 439 new variants here in South Korea, and we have seen 465 new local infections. We have also seen that they were from the local transmissions. And we, for the time being, we are also intensifying and bolstering our quarantine measures and monitoring for all of the foreign entrants. And as for the family members, for all of the foreign entrants, we ask you to comply with the quarantine measures going forward. And next, we have some updates on the risk factors of the COVID-19 infections here in South Korea. First of all, the risk factor is the fact that we have still the widespread local transmissions of the virus. Starting from mid-February, we have seen ease of the social distancing measures, and this has increased the number of local transmissions, and we also see unidentified sources of infections here in South Korea as well. And to this end, we are also looking at all of the people with clinical symptoms who are visiting doctors and pharmacies, and also we are asking them to get tested if they have any symptoms. And also at public and community health centers, we have expanded the scope of free testings, and we also expand the operation of the makeshift testing centers to detect more patients going forward. And as for the virus vulnerable class, we are also intensifying our preemptive testings, and in order to contain the further spread of the virus and the new variants, attendants, we are also going to test the new flight attendants as well. And second, we also see many cluster infections stemming from families and also multi-use facilities, that is, and also especially these facilities include day-to-day venues, including health gyms as well as restaurants and so forth. And after the start of the new school year, we also have seen an increase in the cluster infections stemming from schools, and we also see new workplaces like the public institutions and call centers and so forth. We are also seeing infections there as well. And as for the nightlife entertainment venues, we also have higher risks of infection, so we ask for your particular precaution. And to this end, the government is carrying out our pan-government efforts to look at the virus vulnerable facilities, and if they breach the quarantine measures, we are taking stern measures like penalties or fines. And as for these crackdowns, we are also intensifying them for religious centers as well. And the third risk is the spread of the new variants here in South Korea. As reported earlier, here in South Korea, we are seeing an increase in the number of cluster infections, which is spreading the new variants. And to this end, the quarantine authorities would like to also note that all of the people who are foreign entrants who are also free from their quarantine, we are looking at their plans for the next few days, and also we are going to ask them to get tested for the PCR test as well. And as for the South African variant, which is confirmed to have to make the vaccines less effective, we are also intensifying our quarantine efforts going further as well. And on a daily basis, we are seeing our daily tally hovering around 600. And in order to contain the large spread of the virus, we ask for your continued participation and precaution. First of all, we ask you to take particular precautions in wearing your face mask and personal hygiene measures. And if you have any symptoms, please get tested as soon as possible. The COVID-19 could accompany fever. However, at times, it could also accompany other types of symptoms like cough or sore throat or muscle pain and so forth. So if you have any similar symptoms, do not visit any frequently visited areas, but visit the screening center nearby to get tested as soon as possible. And regardless of where you are, when you are indoors, wear your face mask at all times. And even at outdoors, please wear your face mask at all times if you cannot keep social distancing measures. And also refrain from making situations where you have to take off your mask, like eating, consuming a food or beverage, and smoking. And also we need to ask you to comply with the social distancing measures and also the gathering ban on private gatherings of more than 5 people. And also as for the eligible recipients of COVID-19 vaccines, we ask for your participation going forward as well. And here are our updates on the status on our COVID-19 vaccination. And as of today midnight, we see 1,517,390 people who have been administered with the first dose of COVID-19. And the second dose recipient stands at 60,585. And the Q2 vaccine target group, we see about 17.5% of these vaccination rate right now. And out of the 2Q target group, the most crucial people are the senior citizens over the age of 75. And among them, we have also infected more than 370,000 people right now, which is over 10%. And as for the residents and workers at the nursing hospitals, our vaccination rate stands at about 40%. And we are also going to carry out in full-fledged the vaccination rollout for the senior citizens. And here is an update on our post-inoculation adverse responses. As of today, we see 12,229 cases reported so far, and 98.4%, a majority of them, that is, are mild and common symptoms which are commonly reported after the inoculation. And we see 122 suspected cases of anaphylaxis, 26 suspected cases of severe cases, and 46 cases of death have been reported so far. And as for the post-inoculation adverse responses, we have done the weekly analysis. During the past week, we have seen about 0.2% of these adverse responses being reported, and the accumulated rate stands at about 0.8%, and there were more women, and also the highest response were spotted at the 20th group, and also we see that the younger people were prone to these adverse responses compared to their elderly counterparts. And as for the AstraZeneca vaccines, we have seen about 0.3% of the vaccine adverse responses and about 0.1% for Pfizer vaccines. And the accumulated report rate stand at about 1.1% for AstraZeneca and about 0.2% for Pfizer's vaccine. And also we have seen a slight increase in the adverse responses after the second dose of the Pfizer vaccines. And we have carried out 7th and 8th rounds of the damage team of the post-inoculation, which will be updated to you later by the respective employee. And as for COVID-19 vaccines, we see the first queue recipients, and we have been looking at the effectiveness of the during the past 7 weeks. And we have been looking at the people we have been looking at about 860,000 people who have received their vaccines. And we have seen that after 14 days after the inoculation, we have seen AstraZeneca effectiveness standing at about 93% and 100% for Pfizer vaccines. And as for the senior citizens, here are some analyses. We looked at the eligible recipients above the age of 675, and we excluded those people who have been confirmed with the COVID-19. And we have been looking at these senior citizens, and we have seen after the 14 days after the inoculation, there have been 0 cases of infection of the COVID-19, and we looked at the effectiveness of the vaccines, and 100% were reported in both AstraZeneca and Pfizer vaccines. Right now, this period of the subject or the analysis itself is very short, so we will be providing these weekly analysis reports going further as well. And we also will be carrying out these vaccines, and starting from today, we are carrying out the that is April 10th, we have been carrying out the reservations for the vaccinations, and we have been looking at the target groups. And starting from today, we will be rolling out the vaccines for caregivers, veterans, as well as the service people who at the disabled facilities. And as for the social essential workers and people with dialysis or so forth, we have been looking at the booking in advance, and we have been asking them to book their inoculation in advance. And starting from next week, next Monday, we will be rolling out the vaccines for this target group as well. Originally, the essential social workers were subject to the inoculation starting from June. However, we have been speeding up this date from the late April, and we will be carrying out these inoculations at designated hospitals nationwide, which stand at over 1,000. And we also have been looking at the major symptoms after COVID-19 vaccination, and we have been looking at these medical professionals, and also we have been providing them with guidelines on the looking at the checkup for anyone who has blood clots. And so if you have any headache or blurry eyesight, or also the swelling of the legs and so forth, we ask you to go to the doctor as soon as possible. Thank you very much.
네. 그럼 예방접종 피해 조사반 7차 8.
Right, that was Chung Young with Monday's afternoon briefing, and I have Soa here with a short summary of what she said. Right,
yes, Sunny, there's been an increase by 7.2% of COVID-19 cases, domestic cases here in the nation in the past week. And with that, there's been a 3-week rise in these cases. There's also been an update on variant cases, as 70 new variant infections were detected in the country. That's 35 imported and 35 domestic cases. But what needs to be mentioned is that the government is conducting more swift DNA testings. That is why we're seeing that rise.
I see. All right, Soa, thank you for that.
My pleasure.
역학조사 결과 학교에서는 마스크를 제대로 착용하지 않은 점이 가장 큰 전파의 원인으로 분석되었고
사회적 거리두기 단계를 이렇게 상향 조정해야 될 정도로 심각해지고 있기 때문에 오히려 등교 방침을 조금 조정해야 되지 않는가 하는
장점을 극대화하고 단점을 최소화해서 현재의 과학기술로 대처할 수 있는 것을 충분히 대처해야 되지 않겠습니까?
현실적으로 자가검사 키트에 대한 절차적인 허가도 되어 있지 않아서 학교의 우선 적용을 결정하기에는 시기상조이며
Several factors are greatly raising alarm over the state of COVID-19 affairs here on the local front. Over 2,000 infections have been linked to the academic arena since its opening last month, while capital Seoul has been recording some 200 daily cases in recent days. Now, for more on the risk factors and on efforts to address them, I have Dr. Alice Hyung-Young-Dan from Ms. Medi Women's Hospital. Welcome back, Dr. Dan.
Good afternoon.
And I also have Professor Lee Hoon-sang from Yonsei University. Good to see you again, Professor Lee.
Thank you for having me.
Right then, Dr. Dan, let's begin with your thoughts on Korea's medical capacity in response to the latest COVID-19 situation here in the country.
Fortunately, we're in a much better position now in terms of medical capacity compared to where we were before. So right now we have a little over 600 ICU beds open and available for COVID-19 patients. In terms of space at monitored isolation facilities, we have a little more than 3,000 spaces available. So compared to where we were at the beginning of the third wave back in October, this is a huge improvement. Back then we only had a little over 50 ICU beds, and of course that exacerbated the third wave and the medical situation. So we are in a much better situation, but my concern is even though the rate of rise of this fourth wave is tempered right now, there's evidence that that slope could increase rapidly. The number of cases of unknown epidemiological link has surpassed 2,400 such cases for the period of over the last 2 weeks. And in terms of cases that we're detecting from the community, only 87 unsolicited cases were detected on one day over the weekend. And so what that means to me is that we could potentially have maybe 2,000 active infectious people with COVID-19 in our community that are undetected. And so this is a point of concern.
Right. And against that backdrop, Dr. Dan, as we mentioned earlier in the program, authorities in the country have recorded 9 cases of the double mutant from India. Now, what can you tell us about this particular variant as compared to its counterparts from the UK, South Africa, and Brazil?
Unfortunately, there's not a lot of hard scientific evidence regarding this new variant so far. It's called the B.1.617 variant, and it has 2 troublesome mutations. The first mutation is called the E484Q mutation, and the second is the L452R mutation. And the potential is that it could be what we call an escape variant. In other words, it could evade the diagnostics, perhaps the antibody-based treatments, and also the vaccinations that we have in place right now. The epidemiological evidence, however, does show that it might be more transmissible because of what it's doing in India. It may be responsible for the surge that they are experiencing. However, anecdotally, doctors in India have said that it may not be as lethal as the other variants because they haven't seen the same types of hospitalizations with severe cases yet. But as I said, the hard evidence is still lacking.
Right. Meanwhile, Professor Lee, as I mentioned earlier, some 2,000 cases have been linked to the academic arena since its opening last month. How high would you say are the risks posed by the schools?
So there has been some of the studies that has said that the possibility of the transmission might be lower in school. But what we have to have in mind is that actually the article was written, co-authored by one of the co-author of the article was actually the Korea DCA Director General Dr. Eun Chung. But what we have to keep in mind is that the article was published with the data from May to July of last year, when we had much lower number of cases. So it has to be interpreted with care. And also another aspect is, even though the transmissibility might be lower, but still that does not guarantee that the transmission wouldn't happen. So still basic quarantine measures should be kept very strict. And also a lot of personal protective measures such as wearing mask and social distancing has to be kept. But maybe some of those practices might have been breached. And also there had been actually some of the cases where parents sent their children even though they had the symptoms. So even though there might be lower chance of the transmissions, if you breach those kind of personal hygiene practice measure, then it still can have the students in danger as well.
Right. Professor Lee, is the risk of infection relatively low among children and teenagers?
So according to some of the studies, it seems the transmissibility seems to be somewhat lower than in general populations. And also it is coming from also the population level studies. So especially some of the, as I said, one of the articles came from Korean data. And what we have to keep in mind is maybe during the time, the wearing of the mask and many of the personal hygiene measures might have been kept very strict. But we have to still keep in mind that that does not guarantee that the transmission wouldn't happen in the school.
Of course. Dr. Tan, there is ongoing debate here in capital Seoul about the possible use of self-testing kits within school grounds. What are your thoughts about this particular measure, proposed measure that is, and its potential role in curbing the spread at schools?
Well, you know, there's no true home-based test that's been approved here in our country yet. The SD biosensor rapid antigen kit, that has been approved for emergency use by the WHO and also the US FDA. However, it's not intended to be a home-based test. The recommendation of the WHO is that it be performed by a trained individual. It could be helpful in school-like settings. There are some advantages to a rapid antigen test. It's considered sort of the quick and easy COVID test. It's quick, in other words, we get results back in 15 to 30 minutes. It's easy to perform. It could be done at the point of care. You don't have to actually go to a laboratory or a hospital or a test center. You could have more localized testing. You could have testing in schools as long as someone is trained to oversee the testing procedure. It's less expensive than PCR tests, and it also helps detect people with active SARS-CoV-2 virus, so active disease, whereas as we saw before with the PCR testing, even though a person is no longer infectious, it can still come back positive many days, many weeks later. So there are specific advantages, and it could be used in schools, but I would say not as a sole, not as a freestanding only test. There are campuses in the United States, for example, they use pooled testing, pooled PCR testing as the first level of testing. Some schools are actually using salivary-based PCR testing. And then you can have a rapid antigen test sort of as a second line testing to try to find who among the pooled samples, if one came back positive, who among them is actually carrying the virus. So it is something that we could look into. But as I said, it should not be considered the only test or the first line test that we do in schools.
And staying with that, Professor Lee, initially Seoul officials had proposed the use of these self-testing kits at nightlife entertainment venues. Now, having said that, what do you propose as part of efforts to perhaps maximize the use of these self-testing kits?
Well, at a present moment, I would be a little bit more cautious about using these self-testing kits at this kind of nightclub and social venue. Right now, it is not being recommended by Korea DCA, and one of the reasons is because of the lower sensitivities and higher likelihood of the giving false positive cases. And at the moment, maybe at a situation where we have a much higher daily confirmed cases, and if we have confirmed cases happening in mass, maybe to supplement the limited capacity, maybe there can be of a possibility. But at the moment, especially the saliva self-testing kits has not been approved by Korea FDA, and also I think that the general consensus is in the little bit more careful side. Also, as I had been saying before, the turnaround time for the RT-PCR COVID-19 testing is sometimes as little as 6 hours. So at the moment, I think I would be in a little bit more cautious side about using the self-testing kits.
Right. Doctor, then, amid concerns of very rare blood clots, those aged below 30 here in Korea will not receive the AstraZeneca vaccine. What alternatives do these individuals have, especially those in the academic arena?
Right, so you raise a very important point because teachers and also teaching assistants, especially in the special education sector within the education field, up to 1/3 of teachers, half of teaching assistants, they are actually younger than 30, and so they would not be eligible to receive the AstraZeneca vaccine. So alternatives would be to make the Pfizer vaccine available to this population. Otherwise, in some countries, they're not completely excluding people under 30 from receiving the vaccine. What they are saying is that if the individual person has a discussion with their doctor about the risks and benefits of the AstraZeneca vaccine, and the person actually agrees to get vaccinated, they are making the vaccine available to them. In other words, they are offering the informed consent route of getting vaccinated with AstraZeneca in people who are younger than 30. So that's also another option. Otherwise, unfortunately, it's really a matter of enhancing the education and also the compliance with the current infectious disease control measures that we have in place.
Right, and keeping in mind what Dr. Dan has just said, Professor Lee, what more can authorities do to perhaps curb contagion within school grounds then?
At the moment, I think we have to go back to the basics. I think because it has been quite a long time has passed since the beginning of the pandemic. I mean, it is stressful for adults, and it would be even more stressful for the children as well. So I think the school authority has to be even extra more careful to make sure that students are wearing the mask, they are keeping the social distance. But again, as I said before, it will be really important for parents not to be letting the guard down, and if they have any of the symptoms, if the children or student has any symptoms, to keep them to keep them home. But another aspect is to give a higher priority for vaccinations for the teachers in general, teachers and any of the people who are working in the schools. And another hopeful aspect is currently the Pfizer vaccine has been shown a very high efficacy, almost up to the 100% for the children aged between 12 to 15. So and it is under FDA's review right now. So as soon as the Pfizer vaccine is available, then maybe we can make the priority for vaccination for students in that age group.
Right. One final question then, Dr. Dan. Seoul is hoping to implement an independent framework of COVID-19 prevention measures tailored to the needs of the businesses here in the capital city. What do you suggest to ensure collaboration, better collaboration that is, between local governments and central authorities with regard to containment efforts?
Right, so the Central National Countermeasures Task Force, I think their goal is to come up with scientifically based guidelines that can be applied nationally. However, regional provinces and cities such as the Seoul municipal area, they really have a better sense, of the pulse of what's going on in terms of local outbreaks and clusters, and also sort of the attitude or the compliance of the population in their local communities. And so communication will be key going forward. I mean, at least once a day, maybe twice a day, just talking back and forth in terms of what's going on. And there needs to be, I think, in terms of communication of what the plan is, there should be a sort of a unified front. The worst thing is when there's confusion, right? Or when there's contradictory messages, mixed messages going on. That just makes the public more confused, and of course compliance will go down. And so whatever message is told to the public, I would hope that it becomes a unified message, both on a local but also on a national level.
Right. All right, Dr. Dan, as always, thank you very much for your thoughts, and Professor Lee, thank you very much for your insights.
Thank you.
Right, one explanation for the spread at schools is the failure to get promptly tested despite displaying symptoms of COVID-19. So do make testing a priority. Thank you for watching.